Welcome back to Bloom. Melasma symptoms include dark, irregular, hyperpigmented patches that appear on the cheeks, nose, upper lip, forehead, and chin. They're often called age spots or heirloom kisses. Well, here to talk about treatment solutions for melasma is Dr. Hermann of Hermann Wellness. Welcome back, Dr. Hermann.
Thank you. Good to see you, Carissa.
Thank you for coming back. Before we dive into melasma, you've been working in this area for 20 years. What makes you and your treatments and your patient style so successful?
Well, today we're talking about the Cosmelan Peel for melasma, and I would say, you know, practicing, we go to conferences, I go to conferences all the time, finding new treatments. When I first started, I was told there's really nothing to treat melasma.
Okay.
It's not really sun damage. It's brown spots that are more caused by hormones. The pigment is different. Lasers can actually make it worse.
Wow.
Things like microneedling can make it worse. So the best thing we had to offer was sort of bleaching cream, which was so-so for results.
And you said that's not good enough for me.
Right.
I want to be able to tell my patients this is going to work for melasma.
That's right.
Okay.
So, you know, I go to conferences, I meet with other doctors, I'm always just interacting and trying to figure out what works. And years ago, you know, I learned from another doctor, essentially, that he was using this treatment called a Cosmelan Peel. He swore it was better. He said, you got to try it. I actually had an office manager who had some pretty significant melasma after having a baby. And, you know, it was all across her forehead, like, I mean, this typical melasma and the lip. Dark, a little bit darker skin, so also we would never want to do a laser on that. It could actually hyperpigment, make it worse. So, so we tried this peel, and I really thought, this will be like all the other peels I've tried. And we tried it. I just watched that pigment just, you know, exfoliate off.
Wow.
It was amazing.
Yeah.
And so ever since then, that has become the staple in our practice for treating hyperpigmentation caused by melasma.
So tell me how this peel works and how quickly we see the results. It seemed like it was pretty quick.
Yeah. So you do, actually it looks like a mud mask. We apply it. You wear it for a certain number of hours. So you are committed that day to
do you
looking
stay
like
in
you're
the
wearing.
office or
No, you can walk around. You leave actually.
Oh, okay.
And then we tell you to wash it off at a certain, you know, number of hours based on your skin type. So it could be 6 hours or 8 hours. So you are kind of committed to wearing a mud mask all day.
Yeah.
But
There's worse things. Look, there's worse things you can do.
Right. It's really not downtime. I mean, you can be on the phone or computer, but obviously if you work in a situation where you see people, no. We do weekends. But anyway, so then afterwards there is aftercare where you use certain, you know, wash your face and then put on a bleaching cream for, you know, sort of a routine for the month after. But it's got great results, no risk of burning, no risk of, you know, basically affecting your pigment in a negative way, which is what I love about it, and way more effective than pretty much anything else I've seen on the market.
For these results, how long do they then last after you take off that mud mask?
I mean, well, when you take it off, you actually kind of look the same. And then over the course of a few days, you do get a peel. And you can go, not a bad peel. You can work, you can do your thing, but your skin is, you know,
that's when you're
a little
going
bit
to see the results.
So then you'll see that pigment come off with that peel. But then it lasts, I mean, sometimes people do need a second one where maybe some of it's come off and not all of it. A lot of times one is enough, but if we do a second one, that would be in a month. And then it can last years.
Wow.
You know, I think hormones trigger melasma. If somebody goes on birth control or has another child or gets a lot of sun and goes on birth control,
they may need another treatment,
right?
But they know what to do,
right?
And it's a relatively
But I've also seen it be
process,
a one and done type thing where people don't need it again.
Well, I think your patients love you. I know they love you for researching all these great options. So if melasma is something that you've been concerned with, you can visit drhermann.com.